Hi, everyone. Welcome to the COVID-19 community briefing, 14th edition. So believe it or not, we're 2 touchdowns down the path at this point. So today you can see we, first time ever, we wore uniforms today. And I wish I could say it was planned, but it actually wasn't. So we had Brad Zwart with us today, a physical therapist here at the health system, and I'll introduce Brad in just a moment. I want to give you a few updates that are happening, a few current things going on. One of the things, I always talk about testing, and just yesterday it was determined that meatpacking personnel are deemed essential services personnel. Well, why is that important? That means that they can be tested even though they may not have met the criteria needed for the state hygienic labs to process the test. Now they can. And so simply by nature of being symptomatic, they have some things going on, but again, not enough to merit a test, they can now. And obviously that's in response to the outbreaks that are occurring in the region. So with that background, I'll give you the scoreboard from Orange City Area Health System today. We have a total of 73 tests that have been performed, 3 of those positive. And again, our last positive was April 2. We have 68 negatives, and we currently have 2 tests that are pending. Just some other statistics from across the state. 1 out of every 76 Iowans have been tested at this point. That's a number that seemed a little better than I had anticipated, but 1 out of every 76. There were 467 new cases in Iowa just yesterday. So again, that kind of tells you that we're not out of the woods with this thing. And a lot of those, quite frankly, were Woodbury County yesterday, as those numbers kind of jumped up there a little bit. Sioux City continues to be somewhat of a hot spot. Right now, we're monitoring that very closely. It is not affecting us here right now, but that's not to say that it won't in terms of if there's really a major surge in Sioux City, if we need to accept med-surg patients here, non-COVID related patients here, maybe we can help by doing that. But we're not at that phase yet, and they're able to handle everything that's going on there. But it is a serious issue down in Woodbury County. Sioux County, as an example, and these things change, and it was about an hour ago. In fact, I learned that Sioux County is now at 11 positive cases. And so when you can contrast Sioux County being a total of 11 total from the very beginning of this to however many new cases alone yesterday in Woodbury County, and the 467 in Iowa, pretty small number that we have up here in Sioux County. So very fortunate regarding that. I'm going to talk a little bit more at the end about elective surgeries and kind of what's going on and a couple other things for next week. But let's shift now to physical therapy. And coincidentally, since Brad is here, we can talk about Brad. So Brad has been a physical therapist for over 20 years and full-time in Orange City since 2006. And with the health system specifically now since 2017. So you're an old pro.
Right, sure.
So we asked Brad to come here today and talk about physical therapy in general, particularly in this environment today. And I know that he has a number of categories that he wants to walk through, and then we'll kind of go from there. So Brad, do you want to kick it off?
Sure. In this current environment of pandemic and people not knowing what to do, it's important to do something active. When you talk mental health, when you talk physical health, there's a whole bunch of things you can be doing proactively, and that's been out there. But from a physical therapy standpoint, I'm always concerned with the person that's saying, hey, I'm not exercising because I hurt, because I have a sore shoulder, or my knee hurts, or
no pain, no gain.
Right. But yes, train, don't strain is really where we want to go.
Oh, okay.
Yeah. With the new mantra. Yeah. So, how do we, help those people start getting active again. So, from a physical therapy and occupational therapy standpoint from our department, we certainly can help you with your issue. If you're hurting knee or hand or shoulder, we'll give you exercises, we'll treat you and do that in the department. But we also can give you ideas for how to exercise in spite of knee pain or back pain that are very effective. Because we know exercise turns on a whole bunch of things. You use your muscles aggressively, they turn on hormones and enzymes that help you stay healthier, help your immune system, help your brain, help anxiety, all these things. Exercise is huge. So we want to decrease some of those hurdles to having you do that, through the website, through the Orange City Facebook page and Lemons to Lemonade. Amanda and Ray have done a good job of giving you ideas to exercise, but maybe the first 2 weeks, hey, I went gung-ho and now my knee hurts, so I quit. Well, that's not a good thing in our standpoint, so we can help you with that.
And in terms of your knee pain, as an example, working through that is not going to help you with the COVID-19 diagnosis, but being well in general will. Yeah. And the key thing is, if you can limit the number of comorbidities that you have, in other words, the number of things, if you're obese and have diabetes and all those kinds of things, your chances in a COVID-19 environment are less than if you were well, or if you're practicing some of those social determinants that we have been talking about for a long time. So I think what Brad is talking about with being well will serve you well in a COVID-19 environment.
Yeah, and just getting some traction going forward with these things. You don't have to be all of a sudden well, because if you think that way, you're not going to start. It's taking these steps of going in the right direction. And exercising in general will help you in the short term as well.
The marathon, not the sprint.
Exactly. Yeah. Because we see people that take off too fast and they get hurt. We'll definitely help you and give you some ideas to help you manage that training load to be effective yet. Then what's the safety in our department? We need to address this, because often in physical therapy we're working in close contact with people, some hands-on care, some direction of exercise. So in our department, we're part of the door you come into our department is part of the well clinic. So we're doing screens with every patient on temperature, asking questions, are you well, putting masks on everybody. And then the physical therapy staff and occupational therapy staff, if they're working in close contact with you for a little bit of time, everybody's wearing a mask. And it's just an easy habit to put it on whenever you're working with somebody. So that's what we've done. And then, to not think, oh, if I go to therapy, I'm not going to be able to breathe with a mask. Well, we need you to breathe to exercise. So we might say, yes, take your mask off, because, if you're well, we can do that. But we're trying to just decrease some of these risk things. We have lots of hand sanitizer around. We're using that. We're cleaning anything that a patient or a therapist touches right after they touch it. So there's not that touched person, patient to patient stuff. We've changed a little bit of what we do. We've closed the pools, from a risk and from a standpoint of what the state is saying. We've taken some of our equipment out, just stuff that's tougher to clean. But by and large, we're operation as usual.
We're seeing new business.
We are. Yeah, people are coming in. So we're helping people. We've done a few, there's been early on, there were a few people that were, hey, I'm not coming in till this is over. It's not going away as fast as maybe what people anticipate. It's the long term. So we've done some follow-up phone calls just to, reassure patients they're okay, ask them how they're doing, maybe giving some advice there, but also saying, hey, we're safe. You can come on in and be treated. And this is ranging from elderly people to kids, that need help with sensory integration, to moving their strength forward, for kids that have some birth kind of things that they just needed help early on. So these are good times for that.
And as always, staying current with stuff is just better. I mean, it helps you along, and instead of having to draw back and then catch up again, sometimes maybe that's not even possible. But it's always easier once you're in the mode to keep it going. So that's an important part that Brad brings up, is not only is physical therapy safe, but and I've said this repeatedly on this program, I guess we call it
Nice.
program. Yeah. I think this is one of the safer environments that you can be in. And I also understand that people need to acquiesce to that. People need to acclimate to that. It is part of the new normal. But from the inside out, again, as Brad just said, and as I have been saying too, we're adamant about how we disinfect things, clean things. The hygiene that's practiced in this facility is it's not surpassed anywhere in this community, and it's not that other places in our community aren't safe to go either, but I think this is as safe as you can find. So, Brad, is there anything else that you'd like to add from physical therapy?
You're talking about opening up surgery, some orthopedic stuff,
Yeah.
getting that going again, but there might still be a backlog for a while. So,
Right.
If you're someone that's waiting or anticipating surgery coming up, maybe doing a little bit of therapy beforehand, it might help you address some of your pain if you're, feeling yourself going backwards, and then, kind of prehabilitate, get yourself as strong as you can before you have surgery, so your rehab goes better, so you're back to doing what you need and want to do quicker.
I just happened to be visiting with Dr. Jacobson just a few minutes before the shooting of this program, and he's beginning to, and we'll talk about his surgeries next week now, but he's beginning to schedule cases for next week. So we believe that backlog, particularly regarding orthopedics, is going to start to be addressed now on an outpatient basis, and so that you'll be hearing much more about that. So if you're one of those orthopedic patients out there, you're experiencing some pain, or you want to get tuned up just a little bit before your case, Brad's here and his team is here, and we can get you tuned up for that, and maybe reduce a little bit of the pain prior to surgery as well. I just want to talk a little bit about that again, as we have, as of this morning, we have approved an elective surgery process that will begin really officially Monday morning. We may do some cases on Friday, but really, today's Thursday, so tomorrow would probably not happen very easily. But Monday, surely things will happen. And next week, we anticipate being a fairly full week of surgeries. So, but they're going to be done safely. They're going to be done with literally pages of additional things that we're following to keep not only our staff safe and our patients safe and visitors safe, but just everyone as safe as we can in this environment. So I believe on Monday, or early next week, we'll have Dr. Locker with us, and we'll talk from a surgeon's perspective, what's going on, and have him share with you how comfortable he is and how comfortable the other surgeons are with proceeding with the plan that we have. So stay tuned, a bit of a teaser for next week. So come back. We appreciate that. I'd also like to put a plug in right now for MyChart. If you haven't signed up yet for MyChart, please take a look at that, because one of the things we can do in the future, we anticipate telemedicine to be a significant part of our future. The telemedicine aspect is greatly enhanced if you are a MyChart subscriber. There's no fee for that. We can have people here that can actually help you do that, sign up, but please do that. Go into or you can get a MyChart app from the App Store. Sign up for it that way. Call up here, ask us if we have any suggestions, if you're having problems with that. That would greatly enhance our ability to do telemedicine in the future and make it really easy for you. You've been doing any telemedicine?
We've done a few tele-rehab type things, and it's gone well. With some of the pediatrics have been enhanced. It's a different thing where the therapist actually sees the kid in their home environment and has been able to visit with a parent that usually can't make it to the visits. So, telemedicine and tele-rehab offers something that in clinic doesn't. It's an adjunct, it's a help. It's not, there still needs to be some face-to-face touching of patients, right, so to speak.
And it's not an end-all in the primary care world either. And it has limited availability, limited use. But for those situations where it does apply, let's do it. And we really believe that the insurance industry is going to support and embrace the telemedicine environment from a reimbursement standpoint post COVID-19. So clearly we're working under some waivers right now, and so that world is pretty open, but we expect it to stay open moving ahead. And actually, we're participating in a grant right now that would greatly expand our ability to do telemedicine in terms of switches that we need to boost our Wi-Fi signal, and in iPads and notebooks and things like that. So we're gearing up for a heavy telemedicine presence in the future, and the MyChart signing up would be a great way for you to help us out with that. Anything else, Brad, that you'd like to offer?
Keep moving, and we'll help you move if you need it. Things are looking up, and adding movement just helps you all around.
And so I'll follow up with that by saying, stay vigilant, stay strong, and stay healthy. Thank you for joining us today.